Hello, everyone. So my name is Vilma. I'm the head of people here with Meru Health. And for those of you are joining outside of our team, Meru Health is an online mental health care provider that uses mind-body approach to help people with depression, anxiety, and burnout. And besides cognitive behavioral therapy, personal therapist support, and nutrition, we also have biofeedback practices, and they are an important part of our 12-week program. And so just a short intro into the session. These Meru Talks are our educational forum where we bring in researchers and other experts from different fields to talk about their specialty, their expertise. And this time we have the honor to have Dr. Paul Lehrer on this topic of using biofeedback to improve mental health. And just a quick introduction to Dr. Paul Lehrer. He is a Harvard-trained clinical psychologist and a professor emeritus of psychiatry at Rutgers Medical School. And his clinical practice and research specializes in management of stress and treatment of physical and emotional stress-related disorders. So for the past 20 years, Dr. Lehrer has published widely on the use of biofeedback in this treatment of anxiety, also hypertension and asthma, and is widely considered as the father of biofeedback here in the West. I'm really excited to have him here. Just a few practicalities. So our team has prepared some questions so that we can guide our conversation today. But I do want to make sure that we get as many questions answered as possible also from anyone who's joined today. So please use the Q&A tab on the bottom, and you can post questions anytime. You don't have to wait for us to end this conversation or anything that is unclear. Please just post it in the Q&A tab, and we'll get to them as soon as possible. So are you ready, Dr. Lehrer?
I'm ready.
All right. Well, the first question I would like to start off with is, what is biofeedback? And more specifically, what is heart rate variability biofeedback?
Sure. Well, first, I'd like to say it's a great pleasure to be able to share this information with you. I have been working on heart rate variability biofeedback since the early 1990s. It is one form of biofeedback. You know, there are many kinds of biofeedback that have been around for 50 years. Biofeedback generally involves just giving you information about what's going on in your body in real time in a way that you can use it to control what's going on inside your body. You know, many years ago, people thought that it was beyond your voluntary control to be able to control heart rate, to control skin sweating or gastrointestinal activity or whatever. In fact, we found that when you get real-time information about what's going on in your body, you can exert quite a bit of control over it. And one particular aspect of body's physiology that is very easy to control happens to be heart rate variability. Now, heart rate variability turns out to be an extraordinarily important parameter. You know, your heart rate is not always steady. It's when your Polar device says you have a heartbeat of 70 beats a minute or whatever, that's really an average going back about a minute or 2 minutes. It's not really what your heart rate is at each second, because in fact it changes with each beat. Heart rate is extremely variable. It not only responds to what we're doing, whether we're walking or whether we're thinking or whether we're doing a task or climbing stairs or whatever. It has to change in order to give more blood to the muscles and to the brain. But it also has its own internal rhythms, and it's going up and down all the time. And there are two particular types of rhythm that I'd like to talk about that we particularly target with heart rate variability biofeedback. One of them is called respiratory sinus arrhythmia. What happened, and that means that when you breathe in, your heart rate goes up, and when you breathe out, your heart rate goes down. Now, by and large, the more relaxed you are, and by and large, the healthier you are, the bigger that change takes place, breathing. So it's a very important index. It's an index of what we call the parasympathetic nervous system. which is sort of the rest and digest part of the autonomic nervous system. And when that system is relatively more active, you feel more relaxed. Stress tends to interfere with it. And that's very easily targetable because it involves breathing. And of course, you can change breathing by changing your respiration rate and other parameters of your breathing. Now, there's another rhythm that also is important, important contributor to heart rate variability, and one that we particularly target with heart rate variability biofeedback, and that is the baro reflex, B-A-R-O reflex. You know, you think of it's a pressure reflex, like a barometer is pressure. The baro reflex is a blood pressure control reflex, and it's sensed from sensors in the aorta and in the carotid artery in the neck, and it picks up changes in blood pressure, such that when your blood pressure goes up, your heart rate goes down. And when your blood pressure goes down, your heart rate goes up. And that keeps your blood pressure pretty much at an even keel. If it goes up too much, baro reflex makes it go down. If it goes down too much, your baro reflex makes it go up. But that means that there's a constant rhythm going on because it's always changing. Just like heart rate's always changing, blood pressure is always changing. It goes up a little bit, heart rate changes and goes down a little bit. Now, what happens if you end up breathing at the same rate as the baro reflex? Well, a lot of very interesting things happen. It turns out that you end up stimulating the baro reflex because of certain phase relationships that take place among breathing, heart rate, and blood pressure when you do that. Now, that baro reflex has a slow rhythm, and that rhythm is about a 10-second rhythm. So blood pressure goes up for 5 seconds and then goes down for 5 seconds. And when blood pressure goes up, heart rate goes down. There's less blood flowing through the same size tube. That brings your blood pressure down. That takes a delay of about 5 seconds for that to happen. And then your blood pressure goes down, and then your heart rate goes back up by the baro reflex, and then your blood pressure goes back up, and that takes about 5 seconds. So you get about a 10-second rhythm. However, the rhythm is not the same for everybody. And it depends partly on how much blood you have in your system. With people who are taller and men, by and large, people who are more muscular, they have more blood in the system, so the rhythm is a little bit slower. And each person has his or her own particular rhythm, which is fairly easy to find. So what happens then if you end up breathing at the same rate as the baro reflex? Well, first of all, of course, now you have two things that are being stimulated, right? You're stimulating the baro reflex, and you're also stimulating respiratory sinus arrhythmia, because the two of them are interacting with each other and they're sort of stimulating each other. And more important than that, an even bigger effect than that, is that the baro reflex actually has characteristics of resonance in it. So, those of you who like me also play musical instruments or something are all familiar with resonance. You play your violin in a little room, and it sounds kind of little, but you go into a concert hall and suddenly you fill up the whole hall, even when you're playing softly. Well, that's because the walls of the hall resonate and magnify the sound. Well, the same thing happens in the baro reflex. So that when you stimulate the baro reflex by breathing, respiratory sinus arrhythmia stimulates the baro reflex, stimulates the resonant system, so that you get huge changes in baro reflex, maybe 10 times the amount of the normal baro reflex amplitude. And you have huge oscillations. Now, what happens when you have oscillations that are that big is you're exercising the baro reflex. You're exercising one of the body's main homeostatic control mechanisms. So that certainly controls the autonomic nervous system. it makes the whole autonomic nervous system less reactive to stress, less reactive to other things around you. It strengthens the body's homeostatic control, and it becomes essentially stronger. Now, so how does that affect the emotions? Because we were talking about anxiety and depression as exercising the barrier reflex does a lot of things, actually. It does seem to help. You know, when I talk about this, some people think I'm talking about snake oil. I just did a meta-analysis on the various things that heart rate variability biofeedback helps with. And it does help with anxiety and depression and with stress. It also helps with athletic ability. It helps with modulating blood pressure. It helps people manage pain. It helps a wide variety of functions. Now, why is that? And that is partly because the control of the barrier reflex through the brainstem, through various centers in the brainstem, stimulate parts of the brain that are involved in control. So that, for example, there is a nucleus in the brainstem called nucleus tractus solitarius that directly controls the barrier reflex. So you're stimulating that when you're doing biofeedback. Well, that projects right through part of the nervous system called the limbic system that generates emotion in the brainstem, the amygdala and the insula. But we have been finding in our fMRI research recently that it also affects the connectivity to parts of the cortex, the frontal cortex and cingulate cortex that control emotion, so that you're actually stimulating the parts of the body that connect emotion to emotion control. And that may be one of the reasons why one of the strongest effects that heart rate variability biofeedback seems to have is on depression. It seems to have major effects on depression. It also seems to have major effects on muscular coordination. Athletes are becoming interested in it because it also affects the cerebellum, part of the brain that's involved in muscular coordination, and the occipital cortex that's involved in visual muscular interface coordination. So no, that's essentially what heart rate variability biofeedback is. We ask people to we first of all find what the person's resonance frequency is, and which is fairly easy to do, and then we have people breathe at that rate practice it every day for a while. Practice it when they're feeling stressed out. It has some major immediate effects, and also has major effects over time as the whole system becomes stronger. So
thank you. Yes. I have so many follow-up questions. This is so interesting. You said that it was really easy to find out what that personal, I guess, frequency is at which to breathe. How do you know that? How do you get to that understanding so that you can utilize the breathing exercises, right?
Yes, absolutely. It's fairly easy to do, actually. You just have the person do paced breathing at various rates, and the barrier reflex has a range between about 4.5 times a minute up to about 6.5 times a minute. So it's somewhere in that range. So you have a person breathe for a couple of minutes, 4.5 times a minute, five times a minute, 5.5 times a minute, and so forth. And you measure what their heart rate variability is. And you will find if it's a resonance effect, you'll get all of the activity taking place at one frequency. You can do a spectral analysis online that will show a spectral peak at a single frequency. The heart rate will look like a sine wave going up and down and up and down. There won't be other sources of variability that take place. And you find that there'll be one frequency that'll have the highest amount of that heart rate variability, and it'll be a simple sine wave. and that's your resonant frequency. So it usually takes a couple of sessions to do this. It takes about 20 minutes to do it the first time. But the first time you do it, it's kind of new to you, and doing paced breathing feels a little bit weird sometimes. So usually I like to do it a second time. We get a more reliable estimate.
Got it. Okay. Yeah, makes sense. Makes sense. So you're really just looking for the highest peak in the variability, and that kind of indicates what your personal frequency should be looking like, and what the breathing, I guess the seconds that you're counting basically, and looking into how you're inhaling, exhaling, and holding breath. Okay. So when we're looking into heart rate variability biofeedback, how does that differ from meditation or other breathing practices?
Well, it overlaps with them, of course. There is a meditative component to doing heart rate variability biofeedback, because you're thinking about your breathing. And that is a major component of Zen and various other Eastern meditative disciplines. So it overlaps in some ways with some meditative disciplines. It in some ways is faster to learn than to learn Zen. To really become a master Zen practitioner, you work for several decades doing it in a Zen monastery, and yeah, you have to. It's a major life discipline. So here we can learn it in about 15 minutes. But on the other hand, of course, the goals are somewhat different. The goal here is to control the body. It's not necessarily to produce a state of enlightenment, although it has some components are the same, but it's not exactly the same. Also, I tend to think, I use a lot of relaxation techniques in my work. I teach people muscle relaxation, for example. The muscles, you can learn how to control the muscles so that there's zero amount of muscle tension in the body. Well, the muscles are part of what we call the sympathetic nervous system. That's the fight or flight reflex. So I usually teach people that technique as well as heart rate variability biofeedback, so that they're able to control the sympathetic nervous system at the same time that they're stimulating the parasympathetic nervous system by heart rate variability biofeedback. I also use self-hypnosis, a technique called autogenic training. And sometimes when you are sort of hypnotizing yourself to feel more relaxed, that will increase your heart rate variability as well. Not as much, but it works through a different pathway. In this case, we're stimulating the brain through breathing and heart rate. The other case, you stimulate heart rate and breathing through the brain. So you can do it by self-suggestion. You can do it by meditation, by mindfulness meditation. And all of these techniques work. They are all very helpful. And I find sometimes it's a good idea to learn several of them. And which technique you use really depends partly on your personality and on you and what your interests are. There are some people who like the idea of thinking about their bodies and controlling their bodies and controlling their muscles and controlling their breathing. And by and large, they gravitate to it. It's quite easy. And they will practice it. There are other people who much prefer meditation or more mental activity, hypnotic activity, and they would practice that much more than they think about they don't like thinking about their bodies. Some people like thinking about their minds, not thinking about the bodies. The technique that works is one that you'll use.
Yeah.
So it's important that the practitioner be flexible enough in order to know what kind of what method would be good for each person, and person should use it. And using more than one method, they're additive.
When you're saying that, this is really interesting to me, you're controlling the sympathetic nervous system, you're stimulating the parasympathetic nervous system while doing these breathing exercises. And I wonder, is there a specific time that you have to do that in order to relieve stress, or in order to get control of the sympathetic nervous system and really stimulate that relaxation and feel more balanced? Is there a specific time frame when, let's say, you have a situation where you're really stressed out? Would a few minutes be sufficient, or would you have to do it for longer in the moment?
Well, it's cumulative over about 10 or 15 minutes. But when people are feeling very stressed out, to do it for a minute or two will help.
Right.
Will help you feel less. You'll feel even more relaxed if you do it for 15 minutes. But
right,
it depends. But you often can't do it. Something I have some of my clients and my patients get really worked up when they're seeing a client, and just taking a few deep breaths at resonance frequency is enough to make them feel that they're in control. So sure. Now, in order to have to exercise the barrier reflex and strengthen the system, so that you're more immune to stress, then it's probably a good idea to use any one of these techniques for 15-20 minutes a day at least. And then you get these cumulative effects. So you have the immediate effects, which are huge, and you have the cumulative effects, which are not as great, but they sort of immunize you to some of the effects of stress, and that requires regular practice.
So you can really train that. Yeah. Yeah. So when you think about the effects on mental well-being, such as, for instance, dealing with symptoms of depression or anxiety, what have been some of the key findings from your studies?
Well, not just from my studies, but certainly we show major effects on depression. But I've done a meta-analysis recently, because if you take a look at the number of studies that are taking place worldwide on heart rate variability biofeedback, it looks like a huge accelerated curve that's taking place just in terms of the number of published studies. So it's not just my studies, but it's people's studies from all over the world, really, who've gotten onto this technique. So we know that it affects depression. We know that it affects anxiety. We know it affects muscle coordination. We know it affects pain. Let me talk about one particular physical symptom, though. Because when I've been a psychotherapist for many years, and one thing that I like to talk to psychotherapists about is how important the psychophysiological dimension is to people's problems. And that talk therapy, although it can be helpful in helping people overcome their stresses and understand where the stresses come from and learn how to act more effectively in daily life, that's not the same thing as what you're feeling inside your body. It's not a direct effect. It's an indirect effect. It's not a direct effect. So to have a psychophysiological component is really important. And let me talk about one particular psychophysiological component that affects particularly anxiety disorders, and that's hyperventilation, people breathing too much. Certainly symptoms of panic are essentially one and the same as hyperventilation. What happens is that when you breathe too much, you're blowing off too much carbon dioxide, your blood becomes alkaline. And when that happens, the red blood cells start holding on to the oxygen. Well, that means that it doesn't give oxygen off to the tissues. So as a result of that, your muscle coordination is not so great anymore. You can't think straight because your brain isn't getting enough oxygen. That's when you're breathing too much. And it often happens when we sigh a lot or when we yawn a lot. That's what happens when we become stressed out. Well, turns out that when you do heart rate variability biofeedback, you're able to also modulate the gas exchange. When you're doing heart rate variability biofeedback, your gas exchange efficiency improves. because what happens is that you have more oxygen in your lung just when your heart rate is highest. So your heart rate is able to exchange in the lung is able to exchange the oxygen and the carbon dioxide most efficiently. And that seems to cut down on your respiratory drive and makes you not hyperventilate. So hyperventilation symptoms go away within 30 seconds or a minute. I've had people who have panic attacks who I said, teach them this technique. You go home and try that. Next time you have a panic attack, you'll see you can control that panic attack within minutes, within a minute.
Mm.
So, so anyway,
Yeah, that's a very good tip. Definitely. And then, yeah, I guess you just have to breathe in that specific frequency. So it's good to practice that. So when the situation happens, for instance, a hyperventilation moment, then you know what to go back to and how to control that.
Absolutely. And
Yeah.
not only that, and you also have to learn how to do it in a way that controls ventilation. One of the things I found in some of my first studies of this is that actually when the first time I asked people to do heart rate variability biofeedback, one effect was they started to hyperventilate. Because what would happen is that they would breathe slowly, but they'd overcompensate by breathing too deeply while they were breathing slowly. So one of the things that we build into our training protocol is to breathe in a relaxed way. It's at the same time that you're breathing slowly, breathe abdominally where you don't bring in as much air, and also don't breathe too deeply. Even though you're breathing slowly, you don't have to breathe very deeply because of improved gas exchange, because of the amount of respiration you're doing. You're getting plenty of oxygen. You know, people find it a little bit peculiar to change their breathing because breathing is such an important part of how the body controls itself. And so sometimes people get a little bit anxious about that. And so people have to get used to doing this at the very beginning. And it doesn't take long. It takes often, we can do that within 10, 15 minutes of training. But it's something to keep in mind that you have direct control over your hyperventilation, but you have to learn how to do it. It doesn't come, you can't just read it in the manual and say, all right, this is what I have to do, just do it. Sometimes you'll end up feeling uncomfortable at the very beginning.
So are there any tips for right in the beginning, like you said, you know, breathing into your belly, I guess. What are some other tips that you could provide to people when they want to start practicing these breathing exercises?
Well, breathe into the belly. Don't breathe too deeply. Breathe at the rate that gives you the highest heart rate variability. If you're finding that you're becoming lightheaded or feeling that's usually the first hyperventilation symptom, then just don't breathe so deeply, and you should feel very relaxed after a few minutes of doing this.
And would you say that this is something that people should go and consult help with? Is this something that everyone can just do at home on their own? How would you suggest to go about it?
You know, many people are able to do it just on their own. If they can, and if it works for them, if they're feeling relaxed and they get big changes in heart rate variability and their symptoms are improved, then they may not need any professional help. But I would guess for a fairly large number of people, they need to consult somebody. When I see people who have diagnosed anxiety disorders or depression, then you have a lot of other issues involved, not in addition to just teaching the technique. It's talking to them about how to use it and when to use it, and how to help them manage their particular symptoms. And that if a person has a diagnosable anxiety or depressive disorder, usually it's a good idea to get some professional help, and it often doesn't require a lot of professional help. but I often find that, I mean, I do what's often considered to be fairly short-term therapy. And many people, it's sufficient. Some people just a few sessions, and of course some people with more complicated psychological problems, it can be a longer term deal.
Yeah. Would you say that there's a from your research, for instance, is there an optimal combination of doing heart rate variability biofeedback practices, and maybe you were talking about muscle relaxation before, but any other practices or methods that can be used to optimize the effects?
Well, actually, I kind of describe these various methods to people the first time when we decide that one of these methods would be a good thing to use, and the person themselves decide which one would they like to use. So we start with that one, and then I usually try to teach them another technique or two, and then they can use them all at once. They're not exclusive. You can relax your muscles and breathe at your resonance frequency at the same time, and you can all. And then it often is worthwhile thinking cognitively about how they're interpreting the world, how they're interpreting the stresses in their lives. Are they making catastrophes out of things that are not catastrophes? Are they engaging in other cognitive distortions that are making life worse? And we end up talking about that. We end up doing some training in social skills sometimes, and sometimes we end up talking a lot about how their current problems are related to their childhood upbringing, and how sometimes they're responding today in ways that are similar to ways they responded earlier in life when it's no longer appropriate. So we do all those things. Now the question is, how much time do I spend in a typical therapy session doing this? I mean, there may be a few sessions where I'll spend most of the session doing one or more of these relaxation techniques, and then after that, they will end up being a fairly minor part of a session. Spend a lot more time in talking about other aspects of their problems, and also how to integrate these techniques into their daily life.
How do you decide whether or not to spend an entire session on these practices versus maybe just partially? Is there some indicators there?
Well, usually when I start teaching the technique for the first time, it takes a longer time takes a longer time, right? That's the primary thing, really. After I've taught the technique, there'll be some times when I'll see a patient becoming agitated in the middle of a session, and they may spend some time saying, how about using one of those techniques now, see if you can relax, thinking about some of the things we've just been talking about. And then sometimes the talking becomes much more productive and afterwards, and the person's relaxed. So I've even done this in families where I had the whole family, they're all fighting with each other, and I have them say, all right, everybody sit there, relax. You can talk to each other as long as your muscles are relaxed and you're breathing slowly. And boy, it's amazing how the tenor of the interaction changes at that time.
I can just imagine. Yeah, it's very effective. I mean, we're practicing it in our team. We're starting meetings sometimes with just a very, a mindful moment where we're doing body scans and looking into how we're feeling and breathing slowly. And obviously with our program, with our treatment program, it's a very efficient way to help people. So we're big fans. I do want to open us up to other questions and the Q&A tab. So the tab is on the bottom, and I want to make sure that we get to most of the questions. There are a few already. So there have been questions about the baroreflex. So one of the questions was, is there an elevator pitch you have for explaining the baroreflex and how to practice stimulating it? So really like a
I'm not sure
short
what you mean by
recap of
elevator pitch. What?
an elevator pitch is very like a very, very short recap of how would you explain this in a
Ah,
short way,
ah,
and how to practice stimulating it in the best way. It's like
sure.
just like a short recap, I guess, of
Yeah,
what the baroreflex is.
sure. Actually, it depends mostly on the sophistication of the patient. When I'm working with an engineer, I'll talk a lot about resonance. When I'm talking with a doctor or a nurse, I'll talk a lot about the baroreflex. And when I'm talking to other people, I'll say, look, there is an internal rhythm inside your body that controls your emotions and controls your body. And you can stimulate that by breathing. So that's what I'm going to teach you how to do. I'm going to teach you how to use your breathing to stimulate a reflex that will help you control your emotions, control some of the symptoms you're coming to me with. And it's called, like I say, it's called the baroreflex.
Yeah. Yeah.
You can look it up if you'd like, but I can, and I can then go into the same detailed explanation that I went into with you, depending on what the patient's interested in.
Right. That makes sense. Thank you. Thank you for clarifying that. Another question is, does alternative nostril breathing help with this? I noticed that for me, it does help to get me into resonance much faster.
That's a good question, and I don't know the answer to it because I don't know anybody who's studied it, and I haven't studied it. I could imagine that alternative nostril breathing helps you slow your breathing down, creates a little bit more resistance to breathing. And the more resistance that there is to breathing, the slower you breathe naturally. Had people breathe through respiratory resistors, for example, and that slows down their breathing. So getting you to slow your breathing down is sometimes difficult to some people. And maybe alternative nostril breathing is one way of doing that almost automatically. But perhaps the questioner knows more about this than I do, and it would be very interesting to find out more about it. I've seen very little really parametric research about what alternative nostril breathing does physiologically. It would be rather interesting.
Yeah, it would be interesting to look more into that. And that sounds like a logical explanation. And it slows down the resistance of breathing. And yeah, so definitely. Another question is, how do you see the future of using biofeedback in mental health treatments?
Well, I think right now, near-term future is, I think it's going to be used more. Because I still think that large proportion of mental health practitioners don't use any physiological methods in their treatment, and I'm hoping that in their near, and that's changing, of course, but I think that in the near term, I'm hoping that people are just going to use these techniques more. But another question is, are we going to find out different ways of controlling the body in addition to heart rate variability biofeedback? We know a lot about that already. But are there other things that we can control? Well, yes. I think the body has a lot of rhythms. Baroreflex is just one of them. For example, the gastrointestinal system has a rhythm of about 3 times a minute. Now, that's probably a resonant system. Is there a way that we can stimulate that? If we breathe three times a minute, for example, will we stimulate that rhythm that you can measure with a gastrogram? And it turns out that rhythm may change if the gut is not working properly with diarrhea or constipation. Is it possible that you can control that by breathing at the rhythm of the gut? That's a good area.
That would be interesting, yeah.
Another area is vascular control. Well, we know that the baroreflex doesn't only affect heart rate. It also affects vascular tone. so that when blood pressure goes up, your blood vessels dilate. And that also brings down blood pressure. And it's another control reflex. Well, that reflex has a different rhythm than the heart rate baroreflex. The heart rate baroreflex between 4.5 and 6.5 times a minute. But the vascular tone baroreflex is probably closer to 2 or 3 times a minute. What about that? Now, can you breathe 2 or 3 times a minute? Maybe yes, maybe no. I've worked with some Zen monks who breathed once a minute. Now there's something interesting. That's probably they look like they were affecting the renin-angiotensin system, which affects the blood pressure control and kidney function.
Mm-hmm.
Now, I don't recommend that people breathe once a minute. Then monks that I measured who were doing this showed a lot of cardiac arrhythmias, which made me think they weren't getting enough oxygen. So I don't recommend this for health. It might be okay for Zen practice, but I don't think it's a healthy practice.
Mm-hmm.
But however, there are other ways of stimulating the system than just by breathing.
What would be an example of other techniques than HRVB to stimulate?
Well, we've done work, for example, with rhythmical muscle tension every 10
Mm-hmm.
seconds. And we found you get a big resonant effect in heart rate. Now, you're probably stimulating it through the sympathetic system that way, not the parasympathetic system. You're not doing it by breathing. Breathing doesn't change. But you get this big resonant effect. You're stimulating the baroreflex. Well, I can think of one particular group of people that might be particularly helped with that stimulating the system that way, and that is people with experienced vasovagal syncope, people who faint, and some people faint. Some people show a decrease in blood pressure and fainting. People who are blood phobic, for example, will often faint when exposed to blood stimuli. And some people are parasympathetically tuned in such a way that they show greater. Some of the work we've done in asthma, I almost wonder whether it'd be better to do it with rhythmical muscle tension than with breathing. I'm not sure about that, but because parasympathetic system causes bronchoconstriction, sympathetic system causes bronchodilation. Well, what happens if you end up stimulating the sympathetic system in a way that is helping control the body, not in fight or flight mode? Would that be a better way of helping people with vasovagal syncope? I have a colleague who's doing some work on that. So
that'd be interesting.
Those are just a few other ways that you can think. We've done other things. We've just shown people emotional slides, pictures every 10 seconds, and you found the resonant effect there. I worked with some airplane pilots in a flight simulator, and we had them do simple little tasks like every 10 seconds, turn right, turn left, go up 100 feet, go down 100 feet. We got a resonant effect there too. So,
okay.
So
there's a lot of different
ways you can stimulate a resonant system.
Mm-hmm. So within our team and within our practice, we're using a heart math device, which is tapped to your earlobe, and that it's via Bluetooth and showing on your phone, the frequency at which you're breathing and helping you determine the heart rate variability. What would be some other devices that you have used, maybe with your clients or anywhere else that you've seen, that you would recommend for this?
Well, there is a much cheaper than the heart math device is a program you get for free on your phone. It's called Elite HRV,
mm-hmm.
And that will work along with almost any Bluetooth heart monitor. And it doesn't work with all of them. Unfortunately, it doesn't work with the Apple Watch, but it works with many of them. some of the polar devices, and it works with a very inexpensive device manufactured by a group called Kyto, Kyto, and you can buy that, I think, from Walmart for about $25. So it's much cheaper than the HeartMath device, and it's a little bit more complicated to use, but it's works just as well.
So you just have to have a heart rate monitor, and then that gets connected to your phone, basically.
You need a Bluetooth that will connect to your phone. Bluetooth heart monitor. Every day I look on the internet and there's another one that's out. Some of the devices work pretty well, not perfectly, and those use the camera on your phone. The flash attachment will pass a light through your finger and function as a photoplethysmograph, and will pick up your pulse from the finger. And that works pretty well. I found that some of the new phones, like mine, that have 3 different cameras on it, sometimes get a little bit confused and don't pick up the signal very well. I found it worked pretty well on an old iPhone 5 that had a simple camera. And it also, some people on Android phones find that their finger starts to burn when passing the light through it. The light is a little bit too intense. So you can try one of them. They're free. There are a whole bunch of them out on the internet. You can try one of them out.
Yeah, it's so
called. I think it was called HRV plus coherence. I think it was called.
Okay.
An Italian program that it worked pretty well, but that one also works better with a Bluetooth monitor.
Yeah, and I've noticed also the Oura Ring has practices that you can use, and during those practices it measures also your heart rate variability.
Does it give you feedback? I'm not sure it gives you immediate feedback, does it?
There are practices on it where you can do breathing exercises for it at 10 minutes, and then it gives you a recap of where it was at. So I think it's called Moments in the Oura app. But yeah, it's interesting how there are so many different ways right now. Yeah.
And the Oura Ring is good. It gives you good sleep measures. But the problem is, to do biofeedback, you really need feedback on every breath, which the Oura Ring does not give you.
Right. Yeah. The HeartMath has been really excellent with this. It's been working so well. There's only 2 more questions that I'd like to get to. One of them would be, are you involved in any research at this point around heart rate variability biofeedback?
Oh, personal research? Yeah, I'm officially retired from Rutgers, so I'm not the principal investigator on any projects. I am still analyzing some data that we did on a big biofeedback project for asthma. I'm involved in with another group looking at a very large data set on what's the relationship between resting measures of heart rate variability and depression. It looks like we're getting some very large, significant findings on a data set of tens of thousands of people. So that looks like it's going to be very interesting. I'm doing some work with a group that's studying heart rate variability biofeedback with a major police force. I guess I can't say exactly where it is, but it's a very big police force, and helping them as a way of helping them manage their stress.
These studies are going to be published at some point?
Yes, well, depends on what kind of results we get. I hope we get good results. But yes, of course, the intent is to publish.
Yeah, and I guess my last question would be, are there any other readings or anything else that you would recommend for people who would like to learn more about heart rate variability biofeedback? and the effects, of course, on well-being and how they can utilize it.
Well, absolutely. Actually, can I put in an advertisement for a book I have coming out this month?
Yeah, please.
It's called Principles and Practice of Stress Management, and it is the 4th edition that will be out this month, published by Guilford Publications. I have one chapter, and there's several other chapters that have relevance to it. I have one chapter on heart rate variability biofeedback, where I go through not only the theory but the protocol for doing it, and case examples, and a literature review. And in fact, that book has chapters in it by experts on mindfulness, on muscle relaxation. Actually, I did the chapter on muscle relaxation too, and autogenic training, music therapy, physical exercise, EMDR, biofeedback of carbon dioxide output, capnometry, biofeedback. I may be forgetting 5 or 6 of them, but I think but this is really the most expert book. It's written, each chapter is written by the major experts on each of their techniques, and so I do recommend it, especially for practitioners in the field, and people who are interested in looking also at the research background as well as the how to do it. There is another book that I don't have anything to do with, but I've used a lot. That's sort of a how to do it book, published by a group out in California. And it's called the Relaxation and Stress Reduction Workbook. And it doesn't cover heart rate variability biofeedback, but it does cover a lot of the other techniques. And it covers them fairly well. It has a fairly research-based application. The applications they used are true to what the research findings are. And of all of the self-help books out there, that's the one I think is the best. Relaxation and Stress Reduction Workbook.
Relaxation and Stress Reduction. All right. And your book will be available where?
It's available from Guilford Publications, and eventually it will be available on Amazon and everywhere. It's I believe it's not out yet, but the publisher promised me that it will be out this month, and you can order a copy from Guilford, Guilford, and maybe even from Amazon. I think Amazon probably knows about it at this point too.
Yeah, we'll have to check that out. Thank you so much. Such a good tip. All right. Yeah, just to give us a couple minutes back, we're almost at the hour again. Thank you so much, Dr. Lehrer, for being with us here today and for answering all of our questions and explaining heart rate variability, biofeedback, and the positive effects physiologically and psychologically to us. Any other last words that you'd like to leave us for today?
Well, I just want to thank you all for your attention and for your interest in this topic. And yeah, I'd like to hear from all of you some point about how you're using it in your daily practice. I think the more that this technique is used, I think the more I will feel that the work I've been doing all these years has really paid off. Thank you for your interest.
Definitely. Thank you so much. I hope you have a beautiful rest of the day. Thank you. Bye-bye.